Dr. Fong, I would like to talk to you about gum disease, something which, I think is much more important than most of us see. And again, here's what's happening. When you go to a doctor, to a dentist, and you have gum disease, relatively heavy gum disease, or not so heavy, the doctor will tell you, if you don't fix it, you will lose your teeth in 2 years, 4 years, 10 years, whatever it might be. Nobody can make complete predictions, but you know it's going in that direction, no doubt about it. Well, while this is true, probably, and while this is very, very bad, there is one thing. You dentists are making phenomenal implants, crowns and bridges, and you do wonderful even dentures which are implant supported and quite inexpensive and very, very well workable, almost as close as implant completely. So you're not putting a wooden tooth anymore in it the way George Washington apparently was having it. So kind of, what's the big deal? Besides probably stinking from your mouth for a few years while you have the gum disease. But here's what I have found out, and tell me whether I'm in any shape and form wrong here. When you have a disease in your mouth, a gum disease, it is an infection. And an infection is just that. It infects the whole body. And the mouth is the gateway of the blood vessels. Nothing goes faster into the blood than right around the mouth inside. We know that by taking certain vitamins or whatever it is, B1, and they dissolve, and you're right away there because it goes so fast into the blood. And so here you have this yellow, reddish, ugly pus right there sitting in your mouth, and it drips into your blood vessels. It goes down into your blood to your heart. It's about a foot, and it goes up to your brain, which is another foot. So it doesn't matter which way it goes. Within about a foot, it's in a very dangerous area. It goes down to the kidney. Apparently, there are ladies who have premature born babies, very underweight because of gum disease. The immune system seems to be suffering, so you get a cold and a flu much easier than otherwise. All that stuff. Is this true? Because if it is, wouldn't be the reason to fix your gum disease much more be because of those things than because of the losing teeth, which at least, if you don't mind spending a little bit of money, you can fix it quite nicely.
That's right. You mentioned those medical conditions. It's true. I think the reason why many people don't think that it's important is because periodontal disease may not be painful initially. It can take time for it to eventually become painful for the patient to realize that it's time to have it looked at. But they may already have the early stages of gum disease that's already breaking down the gum tissue and the bone. And so over time, it becomes painful, and that's when they seek it. But really what they should do is that during those early stages, when they notice that their gum tissues are extremely red, or they're swollen, or they're bleeding when they floss, that's definitely a sign to tell them that it's time to have that looked at by a dentist and discuss the options of what is necessary in order to correct it and treat it. So that way it doesn't have an opportunity for it to just continue to snowball and become a larger problem that becomes so problematic that it's too late. Because when I say it's too late, that means that the bone loss has already occurred, and now we can't grow back that bone. We've lost that window of opportunity to try to treat it in the early phases and be preventative about it. So yes, go ahead. You were going to say something, Helen?
Well, and again, the bone loss as bad as it is, because now you're losing more teeth and they cannot be put back in it, so that now you have even a problem putting them back to a certain degree, or you need to do major operations, and you have ways to put the bone back and all that stuff, and you look ugly in between. But again, while all this is happening, you're poisoning your body, you're ruining your immune system. Yes or no?
Yes, that's absolutely correct. You're ruining your own body by neglecting and taking care of it.
Right. Because, for instance, I have heard that lately surgeons, the people who do the knee operations and the hip operations or the tonsils or the appendix, and this type of operations, that those surgeons, over the last very, very few years, just a couple, 2, 3, some years like that, whatever, more and more start demanding a clean bill of oral health. And they're not worried about crooked teeth. They're not even worried about cavities and stuff too much. They just want to have no gum disease in the mouth, because they have found out that if gum disease is present, the body is pre-weakened, and the gum disease here, as we said, it's dripping into the blood, that yellow, reddish, ugly pus, and it goes to the wound in the knee or in the appendix or wherever they had the operation, and it may flare up there, or that the body is so predispositioned in terms of weakness that the whole operation becomes dangerous. And more surgeons are now showing before the surgery, say, go to the dentist, bring me a statement that you have no gum disease, and then I'll operate, otherwise don't. That probably wouldn't apply for gunshot wounds, but there they just operate. But for this type of operations, and it has always been known. I mean, if you had a bronchitis going on, full-blown some lung infection, nobody would take your appendix out. They would first fix the thing. But now they realize that a gum disease is just as bad as a lung infection, and you can't just operate on it. Is there some? I heard those rumors. Is that one way or the other way true? Is it going into this direction?
It is going in this direction, because as healthcare professionals, we're there to try to help you take care of your body. And so if you have a need, we want to ensure that our treatment that we provide for you will become successful. But it's a partnership between you as a patient and with us as the professional. And hand in hand, if we work together, then we can ensure a more successful treatment that's going to give you healthy results. So yes. So the professionals want us.
A gum infection has immediate bad health effects, which, in my opinion, are less repairable because a failed kidney, because that whole thing went down, a liver, a heart, the blood built up in the arteries. That stuff must be a lot more difficult to get rid of and to fix again back to normal than a missing tooth. So it's really that type of stuff which, and this is going on while you're losing bones and losing teeth. So by the time you lost your teeth, you probably already have lost your health, and you are more the doctor doing all kinds of other illnesses which you might never have had to go there, would you not have this huge infection in your mouth for years and years now.
Right. What we don't want to do is to play catch up, because the more damage that's occurred, it's not only just isolated in the mouth, it actually starts to permeate throughout the rest of the body, as you had alluded before. And so the mouth is the window to your health. And if you take care of that, everything else will fall into place. So it is important to address those periodontal concerns and get it taken care of. That will help to allow you to be able to lead a more healthier life.
Well, people, when we have let's just say we have something on the skin has a little wound, a little open infection, which is big like a quarter, like a dime, very small, a half an inch. Well, if it doesn't go away within a few days, week, we run to a dermatologist very fast, as we should. But in the mouth, apparently, we have an infection, a reddish, yellowish type of infection, which is almost as big as our hand, and we don't go. Because we don't see it and we don't feel it, right?
That's right. If you don't see it or you don't feel it, you don't go. But see, that's the thing. It's very important that you have your regular checkups done at the dentist's office. So this way we can help take a look at everything and give you some feedback on what we see, because we can see things that you can't see. And so when we see that and we give you that feedback, then you have the information to make the right decisions so that you can take care of it and have a healthy mouth, a healthy body, and a quality lifestyle.
Right. Well, like they say, the heart attack's kind of like the silent death. It builds up over years. A heart attack really isn't so sudden. It's built up over many, many years.
That's right. It does build up.
But it has built up over many years, and so it kind of silently creeps up on you and kills you. I wouldn't be surprised that one very soon days, the doctors would say, well, one of the biggest silent deaths out there is having the gum disease, because it just kind of keeps getting your body poisoned. Well, Dr. Fong, thank you very much for letting us know. And by the way, one last question: if a person goes regularly to a dentist.
Yes.
And then follows the dental instructions also, not just at home, because apparently no matter what we do at home, it's not necessarily quite enough. A good flosser still needs to go. Some good flossers need to go every couple, 2-3 months still, and we will talk about that in another segment. But can you prevent this gum disease from getting to such a level in the first place if you continuously work on it as a dentist? And basically the patient, he goes it more or less every 6 months, and if there is something to do in terms of gum disease fixing, the dentist does it. Is that a good way to never get into that stage in the first place?
Yes, that is a good way. I myself personally have my teeth cleaned once every 3 to 4 months, even though I should be very meticulous in cleaning my teeth, but there are some areas I just can't reach physically, and so I need to have the help of someone else to go in and help remove the plaque that could be accumulating in those areas. So yes, if we get that looked at, treated on a regular basis, even though we may not be experiencing any pain, but by removing and cleaning those areas up, that will help to prevent the onset of gum disease settling in.
Wonderful. And I guess that's again what it is all about. I guess that's where the saying comes: an ounce of prevention is worth a pound of cure. Dr. Fong, thank you very much.
Thank you.